Hi, this is Brooke Hensley,
Hey, this is Andrew Lateplo.
and today we're going to talk about a case that will make anyone squirm. So, here's the case. It is a 16-month-old previously healthy girl who came in complaining of abdominal pain and decreased PO for 3 days. Actually, she had arrived 1 month ago from the Congo, traveled via Rwanda, and it's really unclear what the child's immunization history. There's a little bit of a language barrier, and
There's a lot of language barrier, actually.
a lot of language barrier. So everyone was working on limited information in this case. So the physical exam was as follows. There are the vitals. The patient actually looked very awake and alert, comfortable, no acute distress, nothing that seemed too out of the ordinary, except the patient had dry mucous membranes. Cap refill was less than 2 seconds. There was no rash, and the abdominal exam was soft with just a little bit of mild diffuse tenderness to palpation. And initially there was a little bit of a workup already done where the patient was initially seen at an outside hospital, and here are some of the initial lab work results. And what's notable is that the child was a little bit anemic, had a little bit of thrombocytosis, borderline leukocytosis, but as you can see that the lymphocytes were elevated, but especially the eosinophils were elevated. The child had an anion gap of 18, probably because she was very dehydrated, and the LFTs were a little bit off as well. And we're not really sure why it was ordered at the outside hospital, but a KUB was done, which was read as nonspecific bowel gas pattern. And an ultrasound was performed at the outside hospital that was concerning, so it was sent over to us for further evaluation. And initially, the images were not available to us at the time, so we performed our own ultrasound.
So this is what you see when we looked right in the epigastric area / right upper quadrant. Just to go through some of the anatomy here, this is abdominal wall, and right here is the peritoneum. This is bowel filled with air, and here we're seeing this is bowel. It's not normal looking bowel. You can see this is fluid within the bowel lumen, and what's very obvious is this tubular structure, this really gross tubular structure, which it turned out to be, Brooke, you want to guess?
That looks terrifyingly like a worm.
It looks terrifyingly like a worm, exactly. So it's actually pretty amazing. So this is a case of Ascaris lumbricoides in a 16-month-old. It's pretty amazing how much detail you can see in this worm because it's really superficial. And if you compare it to just regular anatomy, this is Ascaris anatomy. Thanks, Internet. You can see it's got the walls. It's got these tubular structures in the middle. We're guessing this is a female. Yeah, completely gross. In this view, you can actually see in cross-section, it looks like there are 2 worms. 1, 2 right there. And there's the bowel peristalsi around it. But if you rotate and you look back in the longitudinal view, you can see that this is only 1 worm, 1, 2, and it connects, it's looping around. It's kind of bent right here. So that looked like only 1 worm, but on subsequent views, you can actually see there's this whole nest, this tangle of worms within the intestinal lumen.
You can see them swimming around each other.
Yeah, they're like playing Twister or something. It's like, it's really poor child. We're not making fun of their disease, but it's really pretty gross.
Well, it's amazing how easily you can see the worms on ultrasound.
It's amazing. They're very visible.
So what happened with this child is the patient was admitted to pediatrics with an ID consult. But while the patient was admitted, she continued to have vomiting, coughing, and sneezing of Ascaris worms while on the floor. She was given albendazole and was improving slowly.
Yeah, so just as a note, the child looked really well, and in many parts of the world where parasites like this are very frequent, there's no need for admission. You can just give the albendazole and send them home. Here, where it's not nearly as common, and mostly because there was a large language barrier and lack of social support, the best course of action was to admit the patient. I think in some places they actually just every year on your checkup they just give all children albendazole because they assume that they've been infected. And it's a pretty safe and effective drug.
So while the patient was on the floor, they took a picture of one of the worms that the child vomited or coughed up. And in their notes, they were saying that the worms were up to 6 or 7 inches long. There are multiple episodes of this, and here's just one of them inside one of the sample cups.
Oh, well, so just as a quick review, since we had to review it also, for the Ascaris life cycle. So adult worms can grow up to 35 centimeters long in a human, and they live here in the intestines. A female can make up, this is according to the CDC, the female can make up to 200,000 eggs per day, which comes out to, we did the math, 2.3 eggs per second, which is a ton. Some of them are fertilized, some are not, and they're expelled through the feces into the ground. The fertilized ones mature in the soil in a matter of a couple of weeks, and then when ingested, come back in, go down into the GI tract. The larva can then penetrate through the mucosal wall and get into the portal system, where they then mature and can go through the blood into the lungs, and you can get some pulmonary symptoms as well.
Right. And then that explains how the child was coughing up worms.
Right, that explains how the child is coughing up worms. And actually, so we looked at the liver, and you can actually see this bright S-shaped structure, I think that's within the portal system, and that would explain the liver abnormalities.
Yeah, the ALK phos was elevated in ALT, so
right.
Wow. So just some take-home points from this awesome case. Number 1, always use ultrasound for undifferentiated abdominal pain. Sometimes you're completely surprised and you can nail down the diagnosis.
And remember, there's no harm. There's never a harm in looking.
2, worms apparently are sonolucent.
Very much
now
so.
know that, so maybe you'll find some one day. And last but not least, don't forget to wash your hands before eating.
Definitely before eating. And after eating.
And after eating.
After eating.
So don't forget to visit our website. Thanks for listening.
Bye.
Bye.